Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. In this podcast, I am joined by three Johns Hopkins Medicine experts. First is Paula Neira, who is the program director of the LGBTQ+ Equity and Education at Johns Hopkins Medicine, Office of Diversity, Inclusion, and Health Equity. Next, we have internist Dr. Helene Hedian, who serves as director of the clinical education at the Center for Transgender Health. And finally, we have assistant professor in plastic surgery, Dr. Fan Liang, the medical director for the Center for Transgender Health. So today we are providing you an introduction into the subject of transgender health. So welcome to the three of you, and thank you so much for joining me today.
Thank you for having us.
Thank you.
Yeah, thank you.
So embracing diversity and inclusion, the Center for Transgender Health provides affirming, objective, person-centered care, improving health and enhanced wellness, educating interdisciplinary healthcare professionals to provide culturally competent, evidence-based care, informing the public on transgender health issues, and advancing medical knowledge by conducting biomedical research. So I'd like to first start with Paula. So you as the program director for LGBTQ+ Equity and Education at Johns Hopkins Medicine. Can you provide us some background into Johns Hopkins Medicine's creation of the Center for Transgender Health?
Sure, thanks, Lillie. So the role that I have now is actually a brand new role that was just created earlier this spring, and I had been the clinical program director of our Center for Transgender Health. The very first gender-affirming surgery done in the United States was done here at Johns Hopkins Hospital in the mid-1960s, and there was an original clinic here that was closed in 1979 amidst controversy. And what that did is it created the impression that Johns Hopkins Medicine was not welcoming and supportive of the LGBTQ+ community in general, and then specifically transgender folks. Well, in the 2015-2016 timeframe, the plastic surgeons asked, why aren't we doing this type of surgery here? This is medically necessary care. Why aren't we doing it? At the same time, others were working on raising the clinical and cultural awareness about transgender health across the health system. So in 2016, we formed a executive medicine task force to look at the strengths and weaknesses of the system, because transgender health is more than just surgery. It's really encompassing of many, many disciplines, really trying to provide holistic care. And the Center for Transgender Health is founded as an interdisciplinary service line with all of the different stakeholders that are involved in providing that holistic care. And it's a mission-driven program to really try to rebuild trust with the community and within our tripartite mission of research and education and clinical care to really help move things forward.
Thank you so much. That's an excellent explanation. And I'm fascinated with the history, having personally been at Johns Hopkins almost 40 years. That's interesting to know. Dr. Hedian, you serve as director for clinical education for the center. Can you explain what your role involves?
There is a recent increasing awareness that transgender and gender diverse care, or the care of sexual and gender minorities, generally speaking, should be part of our medical education curriculum. With that being said, there's still room to grow in our and other institutions' undergraduate medical curriculum. There are many different factors that make this a challenge, one of which is, it's simply put, it's not on the exam. Knowing how to care for transgender people is not something that's routinely tested in our licensing exams. And in what is a very brief period of time in medical school, when medical students are responsible for assimilating a lot of knowledge on a wide variety of things, information which isn't on the test sometimes gets deprioritized. So in my role, I am working as a part of a task force which is undergoing a review of the undergraduate medical curriculum. At a graduate level, I have also designed elective rotations for residents who want to learn how to care for transgender and gender diverse patients, whether they are interested in learning about that from a multidisciplinary perspective and rotating through not just internal medicine or primary care, but perhaps plastic surgery, ENT, speech therapy, or if they're interested primarily in learning how to prescribe hormones and offer simply primary care, they can take that focused elective as well. With all that being said, there are many providers in practice today who have had zero education on how to care for transgender people. And we know that primary care physicians in particular feel underprepared to care for this population. One of the largest parts of my role is that I help recruit, mentor, and train PCPs at Hopkins who want to learn how to offer gender-affirming care as part of their primary care practice. And I also help connect these providers with a community of other physicians at Hopkins who are doing similar care. Often each of us might be the only person in our practice who's doing gender-affirming care. And so it's not as easy to just walk down the hallway and ask a colleague's opinion. And so we have to be intentional about the ways that we develop community and really use the intellectual resources that we have here across the institution, broadly speaking.
And when you say across the institution, we're looking at Johns Hopkins Medicine and not just Johns Hopkins Hospital. I just want to say that for our audience listeners today as well. So Drs. Hedian and Liang, you both obviously provide medical services at the Center for Transgender Health. Can you both elaborate on the various services that are offered? You mentioned a few just now, but I imagine that there are some others, particularly perhaps focusing on some psychosocial needs as well. Can you give us a snapshot of what all of that includes?
Gender expansive health is really a complex subject. And the reason why I mentioned this is that everybody sort of brings their individual background to the table when they come and see us at the center. Some patients have a very clear understanding of what types of either medical or surgical interventions they want to undergo. Other patients are just at the very beginning of their gender journey and simply seeking to attain more information about the process and to connect with providers here at Hopkins. So what is really unique about our center is that we really do want to have a very comprehensive modality towards care. And what that really entails is having both providers and also ancillary services to provide the most amount of support and care at any part of the journey. At the center itself, we do have a group of us. So we do have a social worker that can help our patients navigate tricky psychosocial concerns with perioperative surgical support, or if patients are looking for resources within the community, our social worker is really wonderful at connecting patients with those resources. We have a specialty nurse here who has an extensive background in emergency medicine and in taking care of our transgender non-binary population, and is really wonderful when patients have questions about surgical concerns or making sure that they're set up and in a safe and ready place for surgery. We also have a team here that helps out with patient financial services and insurance issues, as these insurance issues can be incredibly complex. We have fellows that work with us that assist with surgeries. We have a tremendous group of community of providers that both myself and Dr. Hedian can speak to. And we cover really all aspects of care, from primary care to hormone therapy, vocal surgery, surgeries that fall under the domain of plastic and reconstructive surgery. We have urologists on board, pelvic floor professionals on board, anesthesiologists that work pretty exclusively with our transgender patients. We also have a surgical oncologist that can come help out when they're patients with a very strong family history of breast cancer and really want that extra specialized care to be able to navigate both the oncologic aspects of gender care with the gender portion of the surgery. We have providers in OB-GYN who can help out with gynecologic issues that a lot of our patients struggle with. We also have geriatricians on board that are an excellent resource for our older patient population. And then we also have a really excellent group of urologic surgeons that can help with either urologic complications or issues with pelvic floor comorbidities. And we all really work together as a team to provide comprehensive surgical and medical care for our patient population.
Do you have anything to add to that, Dr. Hedian?
They're all wonderful.
Yeah, they really are.
Well, I like hearing the fact that it is a multidisciplinary team and that it's not everybody in their own silo, as all too often can happen with patients, no matter where they're getting their care. And it also informs me that you're not just looking at the physical side of things, but also the emotional and the psychosocial needs that these patients are going to have. I'm curious to know, what would be the youngest age of a patient who may initially come to you for a consultation?
I think it really depends, Lillie, on what sort of consultation they're looking for, whether it be from a puberty blockade hormonal standpoint or whether it be from a surgical perspective. In terms of surgical services, we currently don't provide any services for patients younger than the age of 18, although we frequently will see patients who are 17 and thinking about surgery to just initiate that conversation about what to expect and what options are available.
We have a wonderful clinic called Emerge, in which there are 2 pediatricians and adolescent medicine providers who really take a developmental approach in gender care. And so the types of services that patients might receive really depends on what age they are, where they are physiologically, and where they are in their journey. A lot of this is not only patient focused. A lot of care in that age group focuses on helping parents and families and supporting them, connecting them with community resources to help process and understand what this means and how to support their child in a way that is loving and authentic.
I'm pleased to hear you say that you're incorporating this with parents and families. Otherwise, I don't think it could in any way become successful, right? If the patient doesn't have support within their own home, it would make it a whole lot more difficult in order to accomplish their personal goals. Paula, did you have a comment?
What I was going to add is to put this discussion in a little bit broader societal and the current environment context. Is you're absolutely right, is for our prepubescent children, you are talking about supporting the family and providing the support for the child to get that understanding of who they are. And right now in our country, in 2022, there have been over 300 anti-LGBTQ plus pieces of legislation offered in more than half of the United States. These are driven by partisan politics. It's driven by playing to a fear, often grounded in religiosity, that distorts and does not report what the status of the evidence and the status of what medical care is for adolescents by either attempting to criminalize the providing of medical necessary care or barring transgender adolescents from facilities and activities aligned with their gender identity. The World Professional Association for Transgender Health establishes the international standard of care, and those guidelines were just revised. The new revision was out in September. We're in the process of evaluating them because our practices are aligned with those standards of care. When a child reaches puberty, Tanner stage 2 to be really exact for the healthcare professionals listening, that's when you would start thinking about potentially puberty blockers, which is basically putting a pause on puberty. At some point, you just can't block puberty indefinitely without adding cross-gender hormone, usually estrogen or testosterone. And here you're talking about a little bit older adolescent. And then surgery is much closer to the age of 18. 18 was a bright line in the previous standard of care. Today, it's much more individual focused in the assessment of the individual and their cognitive development, their maturity, their understanding, their medical needs. But the care goes from basically reversible to irreversible, which is age and cognitively, developmentally appropriate for the patient. And unfortunately, there's lots of intentional misinformation, lots of willful ignorance on this subject. And that's one of the things that makes a barrier to care for transgender and gender expansive folks to be able to get the medical care that they need.
So just to build on what Paula said, the value of family and social support of trans children and children who are exploring their gender identity really can't be overstated. The research has shown that mental and physical health outcomes are simply better in children who feel supported. And the message that I want parents to take from this is that we love you no matter who you turn out to be. Unconditional love is a really valuable tool to help children really explore their gender and do so in a way that is safe.
And I think when we talk about safety, the unfortunate realities are a recent study by the Trevor Project showed that LGBTQ youth, within the last year, 45% of them had suicidal ideation. And there is nothing inherent about being transgender that makes you suicidal. What makes you suicidal is being treated like crap. We also know studies show that if a transgender youth has one supportive adult in their life, that suicidality is cut in half. And another troubling reality is that only about 1 out of 3 transgender youth live in a home that's supportive of their gender identity. So there's lots of work to be done in trying to make sure that people are hearing evidence-based, scientifically supportive information within a lot of noise, again, that panders to fear and ignorance about transgender folks and particularly about the medical care that's appropriate for transgender youth.
Do you also have support groups for patients and support groups for family members?
As part of the broader coalition of the organizations that are in this field, Here in the local Baltimore, DC area, there are organizations such as Chase Brexton or Whitman Walker. There is an organization called PFLAG, which provides support groups for the families of LGBTQ plus people. And it's working together to be able to provide those resources so we're efficient in being able to meet those needs. And the simple reality is that the demand outstrips the supply of resources for any organization. That's a constant struggle to try to work together to be able to meet that need.
Can you also share with us what type of research is happening at Johns Hopkins in this space?
We do have a dedicated transgender research group that meets weekly, and there is a wide range of topics that are being investigated. The bulk of this research focuses on surgical outcomes and advancing surgical technique, and really looking at ways in which we can best serve our patients and push the boundaries of surgical skill. We also have research looking into differences among race and ethnic groups and looking at facial feminization surgeries. We have as well work that's looking into disparities that are being faced by the transgender non-binary population. And then there's also some work being done regarding like sensation in areas that are typically highly erogenous areas to figure out ways to maximize postoperative maintenance of sensation and augmentation of sensation.
Anything to add to that, Dr. Hedian?
So the research that I am a part of is primarily medical education focused. So as I mentioned, many providers in practice today don't feel prepared to care for transgender patients. And many of them would attribute that lack of preparedness to a lack of knowledge. And I do think it is in part a lack of knowledge and a lack of training. I also think a large part of it, which is perhaps underappreciated, is just unfamiliarity with the community. What I am finding in my research is that focusing on that cultural competency piece is one of the more important tools to not only reduce transphobia and make providers feel more comfortable interacting with trans patients, but also it makes them more willing and probably better prepared to provide hormone therapy and other necessary treatments. The best way to really address transphobia and build cultural competence is actually interactions with the community, interactions with people who are trans identified. We on our website have a number of trainings that are free to access that we've highlighted from external sources that are really high quality, and providers who are interested and want to learn more can access those trainings and start to work on building their own clinical and cultural competence.
One of the things that reflects that this is holistic, and many of the different areas in Johns Hopkins is involved in this, is working on an article in partnership with our chaplaincy education program that is going to share our experience in trying to improve the ability of our chaplains to provide spiritual care to transgender folks, which is so important to the healing process. Another article that is just going to be published is working with our otolaryngology colleagues, looking at the readability of the information that a patient may be able to access about speech pathology on the internet. And then also working with the specialty nurse, Ro Bowman, in our Center for Transgender Health, is publishing an article to provide some education for our perioperative nurses. So it just shows the wide range of where Johns Hopkins is sharing our experiences to try to help the broader healthcare workforce.
I think we're hoping to add to and expand the knowledge and the resources that are available to the clinical community. And I also want to emphasize that we take the voice of the community and the role of community very seriously. And we have held a number of community focus groups over the lifespan of the Center for Transgender Health, especially in the early phases, to really make sure that as we designed the center, it was going to meet the needs of the community.
Now, Lillie, just to raise an example of how community impact and that community connection has driven some of the research questions that we're interested in understanding. There was a lot of interest and some concern about BMI limitations or weight limitations when it came to surgeries, because a lot of surgeons will impose BMI restrictions. BMIs serve as cutoffs above which patients are not eligible for medically necessary surgery. So with that understanding, we went and did our own research studies that really looked at complication rates and outcomes in patients with higher BMI, and really showed that although there were some instances of increased complications such as UTI or wound healing issues, that overall there was not much increased risk with major complications that would be potentially life-threatening. So really no major increase in risk with like stroke or any cardiac events or clotting. And so armed with that knowledge, it's very satisfying to change our clinical practice. And I've really eliminated my BMI requirement for top surgery patients to make this service more accessible to patients that really need it. And it is incredibly helpful to get that feedback from the community so we know where to direct our energy and our efforts.
That's excellent. So you're identifying and removing barriers to care and making it easier to access care.
Exactly.
So if someone was interested in getting a consultation or learning more about the services and programs that are offered, how would they go about doing that with us?
So the best way to just access care is to call the number that is listed on our website. It's 844-546-5645. And that really gets the patient and or their families in contact with our access agents. There will be a brief conversation with this agent to figure out exactly which providers would be best to attend to the patient's needs. And then the patient will be scheduled in for a consultation. And depending on what kind of consultation it is, will dictate who the patient sees and the steps going forward from there. But there's really no one-size-fits-all experience for patients. And we really do try and individualize that process to be able to best address the needs of the patient.
That's great. That's what I like to hear. So thank you for joining us today and to learn about the Center for Transgender Health. Many thanks to Paula Neira and to Drs. Hedian and Liang for sharing such important information into the work that the Johns Hopkins Center for Transgender Health is currently doing and will be doing in the future. And I'm sure that we will have more dialogues with you about this as we continue to educate individuals that listen to our podcast through A Woman's Journey. We hope you will join us next month for another educational and informative podcast featuring another Johns Hopkins Medicine expert. For more information about this and other A Woman's Journey programs, please visit hopkinsmedicine.org/A Woman's Journey. Thank you very much.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from HRH Foundation that supports our podcast series, Insights That Matter. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/A Woman's Journey. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/A Woman's Journey. Until next time, stay well.